All right. So if you're a woman who's dealing with hormonal issues of any sort at any age, be it PMS type of things or low thyroid and issues that are associated with that, or if it is menopause, peri, pre, post, what have you, we have a treat here for you. I've got Carol Peterson, who for 27 years worked with Karen. That was I have the note here. I'm sorry, Women's International Pharmacy, which basically specialized in bioidentical compounding. Is that correct?
Yes, yes.
Okay, okay. So you have a lot of somewhat even unorthodox views on hormones, bioidentical hormones. And I'd love to talk to you about this. That's why we're doing this. And just to preface this, of course, like many, I first saw you when you were interviewed by Dr. Mercola, who's very, very well known in the natural health world. At one point, I think he had the most visited site on the internet for natural health types of things.
I wouldn't be surprised if he still does. I'm just
Oh, okay, okay. I don't know. Yeah, I guess I wouldn't either. A lot of other health experts and gurus have popped up over the years and became quite famous. But he's got a great resource and he's had that for years now. Uh, and so that's where I first saw you. And I really appreciated the interview, the content. I saw that we were aligned on a number of things, and I wanted to just bring your point of view to my audiences, colleagues, and lay people alike, and just to dig into your brain experience, resourcefulness, and all that. So maybe we can start by having you just share your background. How do you get into this?
How'd I get into this? It's kind of a long story, but I'll make it as short as possible. I started out as a pharmacist, and I had some hospital experience, some retail experience, which actually I preferred. I really prefer working with people directly. And I always had this inclination. I don't know it. Have you ever seen Earl Mandel's Vitamin Bible?
Rings the bell. Well,
So a long, long time, right? I used to have it in the pharmacy I worked at, and I would be consulting for people what kind of supplement they ought to be doing for what was going on with them. I called Earl Mandel up one day. He was quite surprised. He said, I have pamphlets that are sold in pharmacies. And he said, I go and quiz the pharmacists. And of course, they haven't read it at all. Uh, they don't have any kind of connection with the natural world. And so I basically went more and more towards this. I did get a job at a very, very busy clinic in Madison, Wisconsin. That's where I had been working. And this clinic was owned by 200 physicians. And all I saw there was a conveyor belt kind of medicine. And it was making me more and more physically sick as I saw people get worse and worse and worse as they returned to their appointments, to the pharmacy.
was that a
And
general practice?
yeah, yeah, there was, well, all kinds of specialties, pediatrics, and cancer, internal medicine, things just not improving the lives and quality of lives of people. So I had sort of a personal crisis, like what to do next. And I was looking at perhaps buying my own pharmacy and had a line on one. And I thought maybe that would be better. I have better control of what I'm doing. And at that time, I also talked with Wally Simons. he called me up out of the blue and said, "Would you like to work here?" Wally Simons actually was a neighbor, and he started Women's International Pharmacy. This was intended to treat PMS. There were a couple researchers, Dr. Hargrove and Maxon, who developed a progesterone in oil oral capsule to make it more convenient to use. We were following Dr. Katarina Dalton's techniques
Right. So
for
she was a pioneer. She was in England, right? She's from England?
she's the one of it. All this information and interest in hormones, the bioidentical hormones, pivots from her work, and she was quite the scientist. And she used very large doses of progesterone to treat. For after deviating away from injectable progesterone, which you could do, and had been used at the time for maintaining a pregnancy. There are moms out there who endured a very painful injection every single day in order to have a successful pregnancy. But she decided that vaginal or rectal suppositories were another option for these women. So the starting dose was like 400 to 600 milligrams suppositories, and they may have to have 2 or 3 a day. And so back in the US, with these researchers, we thought we could make it even more simple by doing the oral capsules in oil. Progesterone had been thought to be not very well absorbed, but technology had allowed for micronization of the powder for progesterone. Smaller particle size equals better absorption. If you put it with oil, alternatively, if you eat it with a fatty meal, your absorption is improved. So that worked out very well.
Okay, so maybe we'll get back to that later on. But progesterone is metabolized differently when it's swallowed orally versus applied to the tissue directly, like
Absolutely.
right?
Yeah, absolutely.
Go ahead.
Absolutely. Actually, Hargrove and Maxon published that progesterone does not get broken down by stomach acid. It goes into the lymphatic system. And this is because this is how fats are absorbed. What gets broken down in the stomach are proteins and carbohydrates, not fats. There's a whole different procedure. It's picked up by chylomicrons. And that's probably true. And a lot of people put out there, oh, this is not well absorbed. It's just going right to the liver, broken down, and that's it. But if you have it with oil or it's in an oil-filled capsule, you have better absorption. We at the time did do some studies with showing relative absorption of this oil-filled capsule to non-oil filled, and absorption was dramatically better. And timed release got to be a thing, and the same milligram strength for timed release. It wasn't really all that timed release at all. Peak time in the serum was about 6 hours out. And with the timed release, because of the methyl cellulose type fillers, was less well absorbed. So why do that at all? It buys you nothing.
So let's make it let's dissect it into some basic ideas here. And I kind of want to get a little bit more into your story as well, but let's just let the viewers who don't know, what are the benefits of progesterone?
Oh my gosh. So that's the thing, because progesterone is so multifactorial in all its activity. It's a very, very pivotal hormone made from cholesterol. And let me caution everybody, it's not a good idea to be lowering your cholesterol. How are you supposed to make your hormones repair your body? We're pretty much sold a bill of goods there.
Right.
So progesterone has many qualities. It can balance estrogen. It can balance adrenaline. It's anti-inflammatory in general. It's antihistamine. If you have a hormone irregularity, in your mast cells. With estrogen being predominant, with not enough progesterone, histamine is released. If you have the progesterone adequate enough, no histamine. We have like a big surge in mast cell activation syndrome all over the place. A lot
Well,
of people think,
I see patients who have significant, what seem like significant histamine reactions to food, different types of food, which affects their digestion, causes bloating and distension, not to mention other types of cognitive symptoms, things like that. So, is that one possible application of progesterone?
yes, progesterone's work in that particular area is to stop the release of histamine. Once it's released, it does not help you detoxify it. You need a DAO and actually methylation, which is kind of an important thing here, how important methylation is. And we have a lot of people who don't methylate, detoxification pathway that's genetically not as strong, and it plays a role in here. So it's antihistamine. It is made independently by the Schwann cells in your nervous system tissue. And
You said antihistamines or histamines?
histamine
Okay. Yeah.
prevents histamine release. Okay, in the Schwann cells, which are the cells that make up your myelin sheath, this is a tissue that protects all of your nerves all over your body. So there's a lot of neurological things that progesterone is really great for. We can't measure this progesterone. Schwann cells make progesterone and pregnenolone and use it right there. It's not going to show up on any existing test. Yet, if you're not doing that, you have a deficiency and you have neurologic problems.
Right. Okay. That's
Okay,
interesting. Okay.
so progesterone is anti-inflammatory. It helps your tissues oxygenate. Your brain makes all these hormones and makes cholesterol independently of the rest of your body. So progesterone is made inside your brain and used right there too. It sits.
And that goes against, I guess, common wisdom that it's only made perhaps in the ovaries, maybe in the uterus, right? And that
Right.
kind of goes back to, and that's was something else I wanted to ask to talk to you about, but that goes back to it. The person who I picked it up from was Dr. Ray Peat, which I think is one of your influences as well. He also had, influenced your kind of line of thinking as well.
Yes, I devoured everything that Ray Peat said. And I can't say that I agree 100% with everything he said.
Right.
And I think he would be the first to welcome any kind of pushback if you're on solid ground.
Yeah.
But he did a tremendous amount of work, and his early books very foundational in some of the things I know now. And the proof is in the pudding. What happens when you apply these ideas? Now,
Yeah.
Ray Peat was not a Katrina Dalton kind of person. He was not saying that lots of progesterone might be really beneficial at times. And in fact, he developed a product with progesterone and vitamin E, not particularly high dose, but could be beneficial if you're aging gently.
Right.
Go for it.
Right.
But there are a lot of women who are really having endocrine messes that need to be addressed. And progesterone can be extremely, extremely good.
Right.
So we
Right.
have all this neurological thing. The fact that it will blunt an insulin glucose response, which I believe at this point, I've kind of evolved to this, that insulin and glucose is the biggest problem we have. If we have a sort of widespread number of symptoms, that insulin glucose balance with relieving insulin resistance is critical. So progesterone can help with that. So can testosterone help with that actually too. So you're not having these really big swings of insulin and glucose. Now, I'd like to say something here. Conventional medicine believes that hot flashes are caused by a lack of estrogen. When your
Right.
hot flash,
Okay, I'm glad that you came to that topic too. So, again, something that I'm sure you see a lot clinically, a lot of women with hot flushes and night sweats and so on. And the common wisdom out there, well, you're getting older, you're making less estrogen, so let's boost your estrogen. And then what happens? So here's the thing. I'd love to hear what you want to say. I cut you off, but I also want to address another question, and we can do both is some women do feel better when they take estrogen. So please feel free to continue with your train of thought. You still remember what what you want to say, but also please address the other thing too.
okay. Ray Peat would say, I'm sort of semi-quoting him from someplace. Estrogen is quite the stimulant. It could even be addictive. He said,
Who
he
said
said,
that?
Ray Peat.
Oh, okay, okay.
He said it's as addictive as cocaine. Ray Peat said
Right.
estrogen
No,
is
I didn't say who. I said ooh, okay. Yeah.
as addictive as cocaine,
All right.
and cocaine is easier for your body to metabolize.
Okay. Wow. Okay. That's a
But
mind bomb.
uh,
All
what
right. Okay.
what's really important here is that women are not low in estrogen when this happens. Dr. Jerry Lynn Pryor from the University of British Columbia published work that demonstrated that women have the highest levels of estrogen in their perimenopausal years.
Any specific forms of estrogen?
Your own estrogen, estradiol's highest. Your ovarian produced estrogen. Of
All
course,
right.
you
And
may.
how did he do you remember how he determined that? Because there is this idea also that I think you and I discussed in one of our email exchanges that blood levels of estrogen, plasma levels of estrogen, don't correlate with tissue levels of estrogen. So how did he come to determine that? Because in the blood, you often see significant drop around menopause.
Or what's more, you do see a drop in estrogen, estradiol. The ovaries are toning down on their production of estradiol. But like I mentioned earlier, there's a lot of hormone production or hormones in the tissues that we don't even have a clue. So when you try to measure urine, saliva, serum, even fingernails and hair, I can you can measure hormones then.
Well, that's
It's
tissue, right? Physical
it's
tissue.
sort of giving you maybe an average or maybe a little point, but we have all these areas where hormone receptors concentrate. Now, for instance, estrogen is a good example. We have concentrations of estrogen receptors in our breasts, in our ovaries, in our uterus. Our muscles don't have too much estrogen. What does that mean? Same thing with progesterone, testosterone, all of them. They have different concentrations of receptors. And it doesn't mean the hormone goes there and has a holiday and sticks around. It's when the hormone goes to the receptor, activates the receptor, work is done, off it goes. We don't have this long-term storage kind of thing. John Lee promulgated the idea that we have fat storage of progesterone. And depending on where you put it, you want to put it on thin-skinned areas because you want to avoid fat storage. He said these things with, just like you're saying, where's the evidence with no fat biopsies? I finally did see when I wanted to do a little bit of a deeper dive into a study where they were doing fat biopsies for hormones. And progesterone wasn't particularly high, but estrogens were. So so it's
Interesting.
another part of the story. And then like if you do a fat biopsy, is it high in that area? Well, what about all your other fatty areas? Are there some areas that like maybe it's all stored in your visceral fat, but not necessarily in some of your other structural fat? Um, Who knows? There's still a lot of PhDs to be had here for research in hormones. A lot
So,
we
so,
don't know.
so basically, what you're saying, and what other, I guess, practitioners and researchers are saying, is that as we get older, as women get older in particular, estrogen levels don't necessarily drop.
Yes, and there's a couple clues in serum work. One is sex hormone binding globulin.
Okay.
Okay, this is a protein made by the liver, carries hormones. It is stimulated by higher estrogen levels and higher cortisol levels, but it binds to testosterone, dihydrotestosterone, and DHEA preferentially.
Right.
So when sex hormone binding globulin is high, you're in a high estrogenic state. And then another one that was identified by Dr. Ray Peat was prolactin,
Yeah.
pituitary hormone that in the case of high estrogen activity and low thyroid, and it's probably the same situation because that high estrogen activity is going to suppress your thyroid activity. So prolactin will rise. And
My understanding is that prolactin rises as a result of increased estrogen production activity, aromatase activity, the enzyme that makes estrogen from
right,
androgens.
right. From testosterone, aromatase is how you make estrogen from testosterone.
Right,
A
right,
lot of people don't even understand that before you get to estrogen, you're gonna have to have testosterone there to convert to estrogen.
right.
So that probably is true that you have increased aromatase activity. Um, but the end result is you may have some pretty okay levels of testosterone, but if you're constantly increasing the estrogen that you make from there, then it's a problem. So often people are, men and women, told to use DIM, and there's pharmaceutical drugs that they like to use. But guess what? Progesterone is an aromatase inhibitor,
Right, right, yeah.
and
And DIM might have estrogenic activity?
it has anti-aromatase
Uh,
enzyme activity.
It does. I read somewhere that it may actually promote estrogen as well.
I wouldn't be surprised because I don't really use it. I would rather go to progesterone.
Yeah, okay.
And my experience is some women think it's okay, and some women can't tolerate it.
Right,
And
right.
and I don't know what's going on there. So I really don't. Progesterone's a
Okay.
safer option.
I want to ask you, by the way, do you know much about calcium D-glucarate as a way to detox estrogen from the liver?
Yes, yes. So your gut microbiome is important to all of this, and this is called enterohepatic recirculation. If you have particular strains of bacteria in your gut that produce this enzyme, beta glucuronidase, it will take estrogen, which has been conjugated in the liver. This is detoxification. You
Yeah.
put a sulfur molecule, you put a methyl group on it, and estrogen is released into your bowel, your gut, for elimination. It's the elimination pathway.
Right.
So if you have these bacteria merely producing a lot of beta glucuronidase, it cleaves that detoxification molecule off. Now you're back to just the hormone, the estradiol
And you
or
reabsorb it.
and poof, right back into your bloodstream
Right.
from the
Right.
colon. And you can actually get enormous levels of even estradiol.
Is
I
that area?
Is it what?
Is it pathogenic bacteria, bad bacteria, so to speak?
Yes, yes. It
So,
would be considered pathogenic because it has a negative effect on
right,
their
right.
body.
Typically present in the small intestines or the large intestines, do you know?
A small intestine is supposed to not have bacteria, but
Right.
I think it's mainly in the large intestine, but I wouldn't rule out small intestine.
Okay, okay. Because much of the absorption activity of nutrients and anything really happens in the small intestines, which are more permeable naturally. My understanding, what I've learned kind of kept my mind over the years, the large intestines are impermeable. And so I would expect that that sort of thing would be associated more with things like SIBO, small intestinal bacterial overgrowth, where you have excessive
Perhaps. Yep.
bacterial presence in the small intestines.
So back to your original question, where does calcium D-glucarate
Yes, please. Yeah.
play a role there? I don't want to lose that. So it binds that enzyme.
Right.
Um,
Okay.
it provides an alternate pathway, gets bound up, and so now your estrogen can be excreted as it normally should.
Right.
So this
Right.
this is a problem.
Would it typically be applicable in cases where there is estrogen dominance and symptoms of estrogen dominance being, sort of PMS type of symptoms or menopausal symptoms that are associated with gastrointestinal disturbances, or would it be useful in general for anyone?
That's a good question. We need to learn more about our digestive tract, and there are organisms there that can actually make 17 beta estradiol and can and do. There's organisms that bind it. There's organisms that do stuff with progesterone and cortisol. We have this wide variety of organisms that can be an issue. Candida, yeast-related problems. There are Candida-related organisms that do make estradiol, and there are Candida-related organisms that bind. So you can have this kind of overgrowth, and you could be extremely starved of estrogen, or you could have estrogen coming out of your ears. Like, where is it coming from? It could be these organisms. Also, really, our guts are really involved in our bacteria. Our friendly bacteria should be helping us with the B vitamins that are methylators to help us detoxify estrogen. So if that flora is off, we don't have the benefit of that. If somebody has a B12 test in the serum, and so they're liking to test that, what's that mean? You're looking at a number that comes from your bacteria, what you eat, and what you supplement. So I look at that number, and if it's on the really, really low side, I think immediately microbiome is suffering here.
Interesting. Okay. Okay. So estrogen has a strong stimulant effect, so it can make you feel good up to a certain degree.
Mhm.
You've seen that before.
Yes.
But
I
then
think
what are the long-term complications of too much estrogen?
it makes things grow.
Hmm.
Okay, so it makes
Okay.
your
Expand on that.
endometrium grow. It makes fibroids grow. But this is expected of estrogen. It's its normal property. Where it gets to be a problem is where progesterone's inadequate to balance it. For example, in the perimenopausal years, you start having really, really heavy bleeding. And what does conventional medicine do? They do one of two things right now. One is they let you bleed till you're begging for a hysterectomy, or two, they insert a Mirena IUD, which has a synthetic analog of progesterone in it. And for some, the bleeding is alleviated, but not for all. Some still bleed with that anyway. It's easy to fix, very easy to fix. And the key is progesterone in the follicular phase, the first part of the menstrual cycle, from day one of bleeding to ovulation. This progesterone does not come from the ovaries, it comes from the adrenal glands. And as you can imagine, as we get more and more stressed and we're putting out more cortisol, and then it sucks up your progesterone, sucks up pregnenolone even. So you don't have anything there to balance that estrogen. So it stimulates more and more growth. All you have to do is restore that. In a couple cycles, you're back to normal bleeding. So easy to fix and so ignored by conventional medicine. It's
What are
really
your
a
thoughts
problem.
about, so talk about estrogen causing growth, and of course it contributes to cancers too, not just fibroids and endometriosis, which of course is an inflammatory aspect there too. But what are your thoughts about this notion of progesterone positive cancers?
Okay, so John Lee, way back when,
Breast
indicated,
cancer, right, specifically?
yeah, and they have a better outcome. And progesterone can work when there's a progesterone receptor there in that tissue to downregulate the growth that is being positively influenced. I came across a study which was quite interesting, and the researchers were from University of California, I think San Diego, and they were working on endometrial cancer, and they found this interesting thing that as the cancer worsened, the progesterone receptors that you had actually diminished. And they were proposing that they would create a test for progesterone receptors so you could determine how bad your cancer was. In the forward, they refer to previous research. Used to be you could reverse endometrial cancer about 50% of the time if you use progesterone. Now, I don't have all the data and what doses were used, but I have seen that in modern day with some physicians just using progesterone. We've kind of abandoned looking at progesterone for endometrial cancer. We just cut out the uterus and make women have
The
chemo
worse the cancer, the
radiation.
less progesterone there is, basically.
Right, right. Interesting, right? So
Yeah.
it's a very positive thing. I'd like to refer people to, and you as well, if you haven't looked at Jeffrey Dash's book, Bioidentical Hormones 101,
Yeah.
a new revised edition is just out. It's very cheap on Kindle right now. And he's got a 3 volume set, so there's a lot to talk about. But his first volume really goes into depth about cancer, breast cancer particularly, and estradiol, estriol, progesterone, testosterone. One of the things we kind of ignore is testosterone is very beneficial in the presence of breast cancer. It actually stimulates an estrogen receptor beta, which is a non-stimulatory receptor and can change the course of breast cancer.
Would you actually administer testosterone?
Yes, there are doctors that do that.
What amounts? Couple
Pardon?
milligrams?
No, probably more than that.
Yeah.
Pellets.
Okay.
I'm thinking Rebecca Glazer has published this great success with breast cancer with testosterone.
Interesting, because there are also good studies on testosterone, the relationship between testosterone, the higher the testosterone, the lesser the incidence and the chance of cancer development in men as well. So it's interesting
Right.
that that's also the case with women. What are some natural ways to increase progesterone and decrease estrogen? We talked about causing D-glucarate perhaps as a way to decrease estrogen, but what are some simple things can be done to increase progesterone?
Vitex increases LH from the pituitary, which stimulates progesterone.
Yeah.
But probably the bigger thing is you don't want to deplete cortisol and derivatives, which is whipped around anytime there's stress, and you preserve your own progesterone. And I think that's the bigger problem. And a big driver of that is when you have a blood glucose drop, up goes adrenaline, usually with cortisol at first, but eventually you exhaust the cortisol.
So what you're saying is go having an intermittent fasting and ketogenic diets and all that good stuff, right?
Yep. I haven't found the perfect solution for insulin
I'm
resistance,
just kidding. I'm just kidding, because right, that's the
but
opposite.
there is. And so what they call, have you heard of the pregnenolone steal?
I don't have I heard of it. I don't remember the details.
Okay,
Please.
well, here's the details. So pregnenolone is the next hormone in line from cholesterol.
Right. So
And
that's sort of the master hormone that is made from
this,
cholesterol, and then from it, all the other steroid hormones are made.
right. So the charts usually go progesterone comes from pregnenolone, DHEA, the major adrenal hormone, comes from pregnenolone. But there's another pathway that's not on the chart, and it's directly to cortisol. Pregnenolone,
Mhm.
pregnenolone goes directly to cortisol. So when you're deplete in cortisol, cortisone, some of the other metabolites. And there's tests for this. You can do saliva or urine tests to see that you're absolutely tanked out. I think pregnenolone is a good choice. And pregnenolone, it's called pregnenolone steel because pregnenolone is now diverted over to make cortisol in derivatives. While it's doing that, it's not making you more progesterone, so your progesterone suffers. So you break that. You use pregnenolone to supplement, help restore the adrenal corticosteroids, and then your progesterone should recover.
So cortisol is useful in as much as it keeps our blood sugar stable. It keeps glucose from going too low. Of course, too much cortisol is implicated in glucose and insulin dysregulation. So how real is that? The cases of not enough cortisol versus too
Too
much
much.
cortisol, which is the natural repercussion of too much excessive constant stress.
Well, it's a continuum. You know, if you're doing too much, and this is happening all the time, eventually your body is not able to make it consistently. And this is where you become so fatigued, it's hard to get out of bed. Your muscles and joints ache, and you have absolutely zero energy. You've just wiped out all those corticosteroids. I think you should pay attention to where that is. You need the corticosteroids. I always say it protects you from your environment. You have to have a normal level of corticosteroids so you're not reactive to everything you run into. So how many people out there, they have trouble with smoke, they can't go out in public, smells, foods, everything exhausts them. Just doing things exhausts them. This is very low corticosteroids. So adrenaline,
And getting out and waking up in the morning feeling still tired, not refreshed. Uh,
right?
okay, right, okay. The clinical test is what? The blood pressure, taking blood pressure in a supine position and getting up. And if you're
Yeah,
dizzy, that's hypostat. What is that again? It's
yeah.
homeostatic hypotension.
That's a great test for low adrenals. Uh,
Right,
and that used to be like if you went to a doctor as part of a standard physical that you do that. And now who does that?
right, right.
Maybe the
Well,
naturopathic
I'm guilty. I mean, I
group.
practice virtually, so I'm guilty of that.
Yeah.
Um,
But I tell my clients to it for themselves. They need to measure it to see where they are, and they can also do this quite easily to measure any progress when they're getting stronger. You can see
right.
that too. I love it. And from those blood pressure machines, you can monitor your heart rate. Ray Peat likes a heart rate of in the 80s
Yeah.
if your thyroid's working okay. And if your thyroid's working okay, you have a good body temperature. So a simple little thermometer can be part of your clinical assessment for yourself.
Right. Absolutely. Absolutely. Yeah. Testing your body temperature is key. So how would you instruct patients, clients to perform the that orthostatic hypotension test?
Just lie down somewhere and get comfortable, and then do a blood pressure, and quickly stand up while you still have the cuff on, and repeat. And your blood pressure should go up when you change your position. That's how your body adapts. And if your blood pressure stays the same or goes down, your adrenals aren't up to making that change for you.
Right.
So people do experience this anyway. They experience like dizziness coming up for them during the day, just seemingly out of the blue, but it could be your just to look at that moment, your adrenals are kind of low.
So could you have someone with sort of a hypercortisol kind of picture, the big, to have the hump, big shoulders, big upper back, puff face, and then still end up with a low cortisol state?
When you get those symptoms, these are really common with the synthetic analogs. Like if you've been using prednisone, prednisolone, betamethasone, triamcinolone, that you actually get into that
Would you
problem.
see that in
But
someone who uses estrogen continuously? I get that sense. At least puffed up, edema.
yeah, I don't know if it's through that pathway or another, quite honestly.
Okay.
But you're right. That buffalo hump kind of thing is likely high cortisol. What relieves that, you can reverse that with testosterone. And just to reemphasize that cortisol, if it's consistently high, it's interfering with your testosterone activity. Testosterone's in charge of all protein synthesis in your body. And just think about it. You can't maintain your muscles or your bones or your immune system protein without adequate testosterone.
And other than giving testosterone directly, what else could you do to increase testosterone if need be?
There's a number of herbs. Actually, I had invited a naturopath I know to do a guest blog because he's got a list and probably too much to go in here. One thing I kind of keep it simple. Pine pollen has testosterone in it, and generous amounts of testosterone can in the pine pollen can be beneficial. And it's superior to bee pollen, which has a little too. But the pine pollen is gotten only from male trees reproductive stuff.
Isn't that
So,
interesting?
isn't it? I
Yeah.
know there's a very fine Canadian company with with the pine pollen. I I think it might even be pinepollen.ca, but
Okay.
that's the usefulness of it.
Okay. And so just to go back to pregnenolone for a moment, so it helps to mitigate, you're saying the cortisol steal? What? No, sorry. What do you call it?
Preg
Which
Pregnenolone steal when pregnenolone's diverted to make more
make
cortisol.
cortisol,
Now,
right, right.
now I
What are
like
some
to
other benefits? Sorry, go ahead.
okay, I like to see a serum pregnenolone, and I am finding it extremely low when I do see it. So between cholesterol to get to pregnenolone, you need active vitamin A. Beta carotene doesn't do it.
Right.
Now, the thyroid, if your thyroid's working, you can convert beta carotene to vitamin A. If you're hypothyroid, that's not happening very well.
That's right. Yeah.
So you could take some vitamin A, or you could use pregnenolone in this situation, or you can help your thyroid work. There's, many ways
Okay.
to do that. But I'm seeing like this is in units, and I think nanograms per deciliter US units. The range should go all the way up to 200. I'm seeing a lot of people with a range, they're like coming up with 10, 15, really, really low.
So what are some applications of pregnenolone?
Okay, so I've ever since I heard this from this is a pearl from Dr. William Clearfield. He said for anxiety in women, he uses 400 milligrams of pregnenolone
Really,
daily.
that high?
Yes, and so all I
Wow.
can. I prefer to maybe do half and half. 200, 200. Hormones are short acting and your body gets rid of them quickly.
And
So,
so where have you seen benefit with, like, practically speaking, in terms of what kind of symptoms and conditions have you seen improve as a result of that?
okay, so if you were using progesterone to treat anxiety, which it can do very, very
Yes,
well, you probably don't need quite as much if you do both hormones to balance that.
right.
Pregnenolone is excellent. It concentrates in the brain for focus and concentration. It's a really good anti-inflammatory and used to be an FDA-approved drug for doses like up to 800 milligrams, if I recall correctly, even larger doses.
And there
But
is good oral absorption and
yep,
utilize,
you could potentially use it topically too, or vaginally, whatever you want.
right.
I
Oh,
I
interesting.
I had a client, I still have it. She's a 20-year-old autistic girl. And here's another little point about progesterone. If you have an overgrowth of Candida going on and you use progesterone, that could worsen. It's another big story. And so I would go over to pregnenolone only in cases like this. So a 20-year-old autistic girl, I was afraid of Candida. That's notorious in autism to have really disturbed guts. So she's taking 400 milligrams of pregnenolone, 200 and 200. And mom tells me for the first time in her life, she's having conversations. Previous to this, she could talk, she
For
could
the first
repeat
time in her life at 20.
at 20.
Wow.
She can have a conversation back and forth with her mom and dad now. I
That's
just get
incredible.
goosebumps every time I tell this story because I think it's so profound.
At 400 milligrams.
400 milligrams. So
Incredible.
before I recommended it to anybody else, I started doing that too, 400 milligrams a day, 200 and 200. And of course, I'm already using hormones, you might guess. And I thought, and I had previously used 150 milligrams for a while, and I didn't really notice anything. But I did notice at the 400, I wasn't having to struggle for words, like you have to go through your mental filing cabinet.
Right.
Things would
So,
just pop right out, and I seem to have a little more resilience.
so it has
So,
a restorative effect on the brain.
yes, very much so.
Okay.
And this is a big issue. Women, when they hit the perimenopausal years, brain fog, very difficult to function in their jobs. Women CEOs who have been powerhouses, all of a sudden they can't think, remember, concentrate. People think that the number one concern of women is breast cancer. I would submit it's probably they want their brains back.
Right. Fair enough. Yeah. And so you said that when someone has Candida, giving progesterone is might make things worse, contraindicated,
Yeah,
both oral and vaginal.
any.
Really?
Um, any. The
Okay.
function,
Why is that?
okay, I did a really deep dive on all this stuff many years ago. I found two reasons why it might be. There might be more. One was that effect on blood glucose, as I mentioned before. It will bring a low blood glucose up if you're using progesterone. So now if there's a Candida overgrowth, now you're providing them with more nutrition, so they'll grow. Candida will grow fast. And then the other one is there's several immune system proteins, which I have not memorized, that are suppressed when you're pregnant, when progesterone is very, very high. These immune system proteins are suppressed so you don't reject your fetus, which has got a whole different DNA, etc. Candida takes advantage of that immune suppression to grow.
Okay. Okay. So what did you have any more thought?
Yeah.
Something else you want to add to this, right?
So if you do have Candida issues, you need to address that first, probably before thinking about progesterone, or
Oh,
at least get in control of it, even if it's just a couple of weeks of anti-Candida therapy. I would love to know if you had a specific protocol, because it's overwhelming. There's so many treatments out there, and I have no way to evaluate what's good, what's the best. But you need to be doing something. You need to be reestablishing your healthy microbiome. You need to be cognizant of your diet and not have too much glucose for them to feed on. And you need
Yeah,
to
absolutely.
probably binders as well when you're killing things off with some
Well, you
Candida
know,
herbs or something. You should mop up the toxins that are released.
yeah, for sure, for sure. So increasing fiber, I think, is important in that regard, certain types of fiber. I subscribe to Ray Peat's notion that you don't want to starve Candida by going very low carb, because then it will bore into the tissue, will, through the intestines. It will, find a way in, and it will just make things worse. But just relatively easy to digest carbohydrates would be good, combined with some good sources of fiber at the same time, depending on the situation.
Mhm.
Um, and so I work with a group of practitioners, and so typically Pod de Arco is one of the things that we would recommend. I found that organ oil can be useful sometimes,
Mhm.
and swallowing garlic, like garlic bits of garlic. You just cut a clove
Mhm.
into three parts and swallow it whole. Um, those are some good things. In general, just improving the energy state of the person,
Mhm.
and sometimes also offsetting and treating just the dealing with the dysbiosis, and on the bacterial level as well, can also help ease the fungal bit as well. Um, so
And a
typically,
friend of mine, Dr. Simon Yu, who's really parasite oriented, he says sometimes if you take care of parasites, you take care of Candida too.
right. Yeah, yeah. And you have things like medications like fluconazole, which kind of seem to work uh, more on fungal infections, but a little bit on parasitic too.
Mhm.
So sometimes, referrals to that sort of thing may be in order. Yeah. So that can be quite effective, I think. Um, all right. So we didn't talk about sort of the we a little bit, we touched on it, but we've gone for quite some time. So I want to start winding things down. But perhaps the master uh, hormone of metabolism, which is tied into all this, is thyroid hormone. Um, so what's the connection between estrogen, progesterone, pregnenolone, all these things, and thyroid hormone? And can you improve progesterone to estrogen ratios and balance, and address hyperestrogenic state to actually improve thyroid function?
Well, the answer to the end is yes, you can. And Ray Peat wrote somewhere that the number of things that interfere with your thyroid, if you had a list in even small print, it would be as long as your arm. Things that support your thyroid are pregnenolone, progesterone, and coconut oil. Did a little deeper dive on coconut oil because we think about short chain fatty acids, but it's actually got steroid cholesterol-like molecules in there too, which may be how it helps your thyroid. Iodine. I am a fan of iodine, and
Are you a fan of iodine?
yes, I am.
Yeah.
And often it's low iodine is tied into this excessive estrogen thing. And anytime you're growing lumps and things, cysts and whatnot, always suspect low iodine. My entry level with somebody is to use progesterone and or Pregnenolone or just Pregnenolone and iodine. And I have them monitor their temperature with that in place first and see if that's all they need. Sometimes
Right.
it is. You can shift the thyroid, getting supported. Now all of a sudden your metabolic rate increases. No further action needed. Another little piece of thyroid is that you do need methylation to convert the relatively inactive thyroid T4, 4 iodine molecules, that's why you want iodine, to T3, the most active thyroid hormone. And T3 works in your mitochondria. It's got two responsibilities. One is to create energy, ATP, in the mitochondria, and the other is to maintain your body temperature. That's
Right.
why body temperature readings can be useful.
Right. Right. For
So,
sure. For sure.
so we want that activity.
Yeah.
I've made kind of a discovery. People who are low thyroid can be very active people. And why is that so? Because they would otherwise have a low body temperature. They have already found if they keep themselves busy,
Yes.
moving, they compensate for low thyroid.
Right. Right. Right.
I
Absolutely.
talked to one woman who was a marathoner. She said, I feel my best when I'm running a marathon. So what she's doing, she's revving up her temperature, all her bodily functions go at their optimum rate.
Yeah. And the paradox is that can also further deteriorate her thyroid function.
Right. Now, if she's creating cortisol from this activity, too
Yeah.
much exercise, that blunts your thyroid.
Yeah. 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 For sure. For sure. And of course, a lot of women in that state also don't eat enough and they need enough glucose to get those hormones up and running. And I see that
They're
too.
often not eating enough, period. As we age, we need more protein than we're younger. We have a harder time digesting it, but we need more.
Mm.
So it tends to, people are eating less and less, and they can't maintain their bodily function. So thyroid's a protein hormone.
Yeah.
Really, if you're not eating enough protein, you can't make it. So I look for that as a first step. And if there's no budge in temperature with these support hormones, which need to be there for you to take thyroid successfully. If a doctor goes, identifies a low thyroid person, just goes to thyroid, sometimes they can't take it without the adrenal support.
That's right. That's
They
right.
get heart
Yeah. And
palpitations and
they still, they retain all these symptoms. The symptoms often don't go away. Sometimes they
yeah,
do, sometimes they don't. Often they don't.
they don't. I believe I've heard that T4, levothyroxine, is the number one prescribed drug right now.
That's right. Yeah, I looked into that. It is
It's
absolutely is crazy. Yeah. Yeah.
and what percentage of people actually get a benefit from that? So I've been asking it when I have a client, I say, and they're on thyroid, I said, well, is that working for you?
Yes,
And they're
exactly.
like, they're so startled.
Yeah. Yeah, they
And
are.
I said, well, you have to have your metabolic rate
It's a
improved.
big, big eye opener. Absolutely.
Yes,
Absolutely.
so it's so important. Thyroid is so important, but so is this whole endocrine system.
Yeah.
And this is another really fault of conventional medicine. They like to make little silos, thyroid here, diabetes, insulin, glucose, prediabetes here, uh, sex hormones
Except
here.
it's all connected.
It's
Yeah.
all interconnected.
Yeah.
Somebody asked me, I gave her protocol to do. She goes, oh, can I start with one thing at a time? I say, you can do whatever you like, but if you want, if these things I gave you support each other and really,
Hence, and
oh,
hence holistic medicine, holism,
yes,
right?
exactly.
Yeah.
So I
Yeah.
was really encouraged. The same time she's asking that, I had somebody else who was doing a coaching program with me. She's at the end and she's doing fantastic. And I said, well, let's wrap it up. Tell me exactly where you are, what you're doing right now. And she goes, I'm doing exactly what you told me. And she had did the whole list. And I said, that's just beautiful. I'm so
Yeah.
happy.
Yeah. It's gratifying. It's gratifying to see that for sure. So, Carol, I'd love to talk more with you, but it might be overwhelming, and maybe we'll do it again. So let's wrap it up and let's let people know where they can find you. Um, yeah, where can we find you?
My website and the name of my YouTube channel is the Wellness by Design Project.com.
Okay.
Okay, and I have a lot of information there, and I would hope that people go there and start paying some attention to some of the things I'm offering free, because you need that background. The whole point of what I'm doing is I want people to take charge of themselves. You have to be the observer. You have to pay attention to what's working. Like I mentioned before, tests are not that useful. Sometimes you can find some silent things that you hadn't thought about, but other than that, it is not an indicator of what to take, when to take, how to take. It's you have to manage your physical signs and symptoms, and that has to improve. And I want everybody to go for 100%. Don't just say, okay, I can live with this. I had a client the other day. She said, oh, I'm feeling so much better. She said, but I guess I'll just live with this extra 5 pounds. I go, don't say that. That means we're not quite there. I want that for you. I want you to
That's
be
right. That's right.
perfectly satisfied.
Fantastic. Well, I would encourage viewers to reach out, and if colleagues watch it, maybe they can reach out as well to gain some wisdom. And I really appreciate you doing this with me. It was amazing. Thank you.
Yeah, thanks for the opportunity, Ellie.
Awesome.